Hey guys, and welcome back to my channel. My name is Takia and you're watching Life with Kia. So everyone, I decided to come on here. Well, let me not lie. My best friend Morgan, shout out to her. Go follow her on her channel, Philosophy. I'll link it down below. She has a pharmacy channel, so if you have any friends or if you just want to watch it for yourself, you can go. But she recommended to me actually today to talk about my clinical experiences. So I'm going to make 3 separate videos for my 3 separate clinicals. This one is going to be med-surg or adult health. The next one will be pediatrics clinical. The third one will be labor and delivery, clinical. So I just want to start off with med-surg because I'm finally finished. Well, I've been finished. I just haven't been around to make this vlog or video. But so I finished med-surg. I'm clinical. I'm still taking the class. My finals are next month. But basically, I was at one of my local hospitals, and so let me start off what days I went. So I was scheduled to go every day, Thursday and Friday, back to back, from 6:30 to 3:15, both days. And we started off for like the first 3 or 4 weeks having just one patient. So we would have that one patient Thursday and Friday unless they're discharged. And we would document on them and everything. And then the last few weeks, we had 2 patients. So Thursday we would have 2 patients and Friday we would have the same 2 patients or switch it out if somebody left or something like that. So like it really taught me time management. But let me just start off with a typical day of clinical would look like. So I would wake up, sorry if you hear anything, it's raining outside and it's like so gloomy. I have like my light right here because it's so dark. But so basically we would wake up, I would wake up at around, I would try to wake up at 4:30, but it wouldn't happen. And I would get dressed, get ready. I would always already have my stuff laid out. That's a tip. Have your stuff laid out the night before, everything, so you're not rushing. If you overslept, you got everything ready to go. Make sure you have a pen. Make sure you have your watch because you need that. My clinical paperwork and all that. And I would go downstairs, make my coffee, pack a snack, pack my lunch. I would usually pack a lunch before, like the night before, just so I can be ahead of the game. And then I would like head out the door. I would try to get there before 6:30, so I would leave. It takes about 22 to 25 minutes to get there. So I would try to leave at like 5:50. Then we would get there, we would meet up, we would get on the floor. We're on the 4th floor. Also just a regular med-surg floor, so we saw everything, anything. So we would get on the floor, we would put our bags down, we would get our assignment from our clinical instructor, say, okay, Takia, you have this patient in room so-and-so and so-and-so, this is the VIN number. Then we would go into the computer, add them to our list, and say we're a nursing student. What I did was look up the last name, age, medications they're on, and like pertinent history. So like, oh, this person has asthma and they're in here for an asthma attack and they're taking this and this at this time. And then I will also look at the 9 o'clock meds because we gave meds from 9 to like 12 or 1. So I would look all that up just to have a knowledge of the patient. So then we would meet our patient, like we would meet our nurse, and we would say, hi, my name is Takia. I am going to be helping you out in patient so-and-so in room so-and-so. And she was like, okay. And then I would just follow her while she gets report from the night nurse. And I would listen. I would have my pad. I wish I had a pad. So, sorry. This is a little pad that I got. I got this from Dollar Tree, and it came with a pack of 3 for $1. And it's small. It fit in my scrub pocket. I could pull it out. I would write vitals. I would write impertinent labs, medications that I need to look up. Of course, no like last names or anything, but just like the room number for that day. And making sure I knew what I was supposed to be doing. And during handoff, I would write notes and stuff like that. And then I would go and get 8 o'clock vitals. I would go and meet the patient. What I like to do while I'm getting vitals, I like to talk to the patient. Hi, so what brought you in today? And what's going on, just so I can get their perspective, like their subjective information. For instance, I had a patient, he came in for hyperglycemia. Like he came in, his blood sugar was like over 500. He said he had blurry vision. He said he had really bad chest pain, like stumbling and all that. He got here and he was just explaining it to me. So I knew, I looked in the chart, he came for hyperglycemic basically attack because he was just out of it. And I saw his labs and everything, so I know it was horrible. And he had like a venous stasis ulcer wound on his leg. So I would ask him about that, ask him how he's treating it, medication that he takes at home, all while I'm getting vitals. So I'm not just wasting time. I'm getting the vitals and also getting their side of the story, if that makes sense. And I like to just build that relationship. I like to sometimes make jokes when it's appropriate. Like, don't just go in there if they're horrible. Don't be like talking about random stuff because they're gonna look at you like, what are you talking about? But you can talk about random stuff, make jokes. A lot of people talk about my height, so that's a starter if I play basketball, which I don't, but that's like a whole talking point. And then I chart my vitals, and then I get ready to look up my meds. So we go into the MAR. That's where in our documentation or online database, it's called the MAR, where they have all the medications listed. And I would basically write it down. We have to put it in our clinical, paperwork. Then I would go to my instructor, make sure I would get my meds from my nurse and double check. Then I would go to my clinical instructor, we would give meds. Then just throughout the day, I'm just doing various things that need to be done. So if they need to go to surgery, sometimes we're allowed to go to surgery with them. Say if someone needs an IV, I tried an IV. Okay, so let me tell you about the first time I tried an IV. Hint on tried. So I had this patient who came in, like we found out, me and the nurse found out that he was having a detox from some type of street drug. He didn't really specify, but we know it was like some type of street drug. And he was detoxing from it. So this was day 3, we realized. And his pulses were bounding, like 3+, you know? I looked down at his foot, bounding, just like boom, 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 out in my face. Like I could see the pulse. I did not have to feel it, but I did feel it. But it was like bounding. And I was just like, are you okay, sir? Like, are you okay? Do you feel lightheaded? Do you feel dizzy? Are you hot? No, I'm chilling. Okay. All right. Blood pressure through the roof. Mind you, this man is not big. This man is skinny. Like, it's not, he looks normal, but he's detoxing. That's what we realized. From alcohol and some type of street drug. It was just a lot. But he had amazing veins. Okay, I know a lot of people say like, okay, nurses know how to find good veins. No, some patients really have good veins. So I get the nurse. So she was amazing, love her. But we got all our supplies, and she was like, "You ready?" And I was just like, yeah. And then me and one of my other good friends from nursing school, she came in with me for moral support. And so I got all my supplies ready, put on my gloves, and I was like, "Thank you so much for letting me practice on you." He was like, "No problem, go ahead." And we were just talking, and I was like, "Clean the spot." So I got the needle, and like she was right there, like helping me, because she had the tape, because you know it's like it moves fast, and once you see blood, you're just like, ugh. So like so I'm ready, and all of a sudden, like I stick him at the angle, like I was in there, and then he joked and said, "Ow," but it didn't really hurt. You know when people joke and be like, "Ow, that hurt." Why would you do that? I could have gotten it in if he wouldn't have said "ow," because when he said "ow," I was like, I thought it was hurting. I was hurting him, but I wasn't. So I didn't get it in, and basically the clinical instructor saved it. So yeah, that's that on that. Yeah. Okay, so I stopped recording. I think I lost storage, but yeah, I learned a lot with her. Another thing that I really enjoyed about clinical, especially the med-surg clinical, is that seeing the teamwork of the nurses. I really love that. I really love that even the manager was not too good to go into a patient's room and hang an antibiotic because they need it, or go and give a pain medicine to one of the nurses on the floor as patient because they were backed up. Like, I loved seeing that. I love seeing that. That shows that you love your job and you're there for the patient and not just for that check. I mean, even though you will get a check, but like you also are there for your patients. And I really love that. Another thing that I loved about the floor and just med surg is that you get to do so much and it makes you feel like a nurse. You get to teach, you get to help pass meds, you get to do wound care, you get to help with surgeries, you get to talk to physicians, you get to talk to surgeons and interact with PT. The pharmacist, like you get to talk to everyone and it makes you feel like, wow, I know something. I just love that because it makes me feel like, okay, I know this. Like I can tell you what I know because I know it. Like another thing that I love to do is just being personable with the patients, not being sympathetic, but being empathetic. And it's important to know the difference, not to be feeling bad for them, but being caring for them. Another part of clinical, and I'm gonna wrap it up, another part of clinical that I really liked, for my med-surg class, we were able to go to the OR for a day instead of going to clinical. That was amazing. Let me tell you here, that was amazing. I realized that the OR was not for me. No. I saw a hip replacement. I was like, that's a lot. We got to talk to the surgeon. He was helpful, I guess. We got to saw how everybody worked in the OR, what the nurse's job, and the circulating nurse and all like that, like seeing how they interact with each other. And then we saw a total vaginal hysterectomy. I started to get lightheaded. I was just like, girl, I'm gonna have to leave because we went in pairs. I was like, girl, I cannot stay in here. So I like stood out and like watched from the outside. And then also that day we were able to go to the cath lab. So we were able to see how a cardiac cath lab worked, that whole procedure, how they go into the femoral artery, whatever, artery, and they go in. It was just really cool. We saw all of that. All in all, I really loved med-surg. I really loved med-surg. This clinical rotation literally helped me and encouraged me to keep going into nursing and be like, Takia, you need to like do it so you can help these people. Last thing before I go, I want to talk about my clinical instructor. So my clinical instructor was a mixture of all of that. She was strict to the point where she wanted your clinical paperwork to be on point, but she also wanted you to make sure your patient was taken care of. She never belittled you, or not to me, not that I knew of. She didn't make me seem less than whatever because I didn't know anything. She would just be like, okay, well, let's look that up before we give it. She would really just say, hey, do you need any help with anything? She would go in and do things with us, like different procedures. If we didn't feel comfortable, I felt like I could go to her for a lot of things, and I did. I asked her multiple questions, and I felt like I've grown from that clinical. Like that clinical was the highlight, even though it was draining. It was a lot. But I can say like I've grown and I've become more comfortable walking to a patient's room saying, hi, my name is Takia and I'll be your student nurse today. Like I have become so confident because of that clinical, and I wouldn't trade being at any other hospital, on any other floor, under any other nurses or any other clinical instructor, because I learned a lot and I feel very confident in my skills. And I'm so thankful that I'm able to say that. So okay, so I think that's it about this clinical. Stay tuned for my next video, which is going to be about peds. If you don't know, I want to be a peds nurse, pediatric nurse. But I feel like that's it on this video. If you have any stories about your clinical experience, your med-surg clinical experience, put that down below. If you have any questions, put that down below. Or you can follow me on my Instagram @_lifewithkia, and you can DM me there any questions that you have, and then I also do different updates on there. Yeah, thank you for watching this video. I hope this helped, and I hope this shines some light on what to expect. So thank you for watching. Bye.